Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Welcome back to This Just In Radio Show, broadcasting live from sunny Las Vegas. And for Health 2025, my very good friend, Rasu Shrestha, thank you for joining us.
Yeah, absolutely.
As always, thank you.
I'm taking your word for it that it's sunny Las Vegas because I have not been outside. I mean, look.
Exactly. We've been trapped in the building. So first of all, it's been a good couple days for you here.
It's been great. It's been fantastic. Yeah.
So what's your main goal for attending health in these events in general?
Yeah. So the word of the year for me this year was intentionality. So when I come to a conference like Health, it is about intentionally meeting with just a handful of curated folks that would accelerate the pace of some of the things that we're doing, right? So CEOs, some investors, but also some acquaintances, right? Because at the end of the day, this really is about the human elements of how we connect the dots. So that's really important. So, handful of that. This year was also fortunate to have been invited to give a talk on the main stage here, and just finished my keynote today. So that was another main goal for me at Health this year, was just to get the word out and talk about some of the really cool things that we're doing at Advocate Health in Charlotte, North Carolina, and really across the health system. But yeah.
Absolutely. So tell me a little bit about the keynote.
Yeah, so I talked about the Pearl. The Pearl is the Innovation District in Charlotte, North Carolina.
You launched it, or you started talking about it last year on the show that you guys are coming up and you just officially launched it now.
Exactly, that's right. We broke ground 2 years ago and just launched it June of 2025. And just about 3 weeks ago was when we also launched IRCAD North America, which is really a destination center for surgeons around experiential learning, surgical simulation, robotics, and minimally invasive surgery, AI. So it's just been absolutely one thing after another, really amazing. But look, at the end of the day, the Pearl Innovation District in Charlotte, North Carolina is about three things. It's about the trifecta of health, learning, and community, right? Health because not just healthcare or sick care, right? Really health, right? How do you really push the boundaries of clinical advancements, but innovations and technologies and business model innovation around health? Learning, right? This is also the home to Charlotte's first four-year medical school. Charlotte was one of the largest metropolitan cities in North America that did not have a four-year medical school. And we'd said a couple of years ago that we would solve for that. And now it's a past tense. So Charlotte was the largest metropolitan city in North America to not have a four-year medical school. So we just went live with the first batch.
So that's the Pearl. I thought it was an innovation center, but it's also a medical school. It's an innovation center as well.
Absolutely.
Correct?
So what is not innovative about medical school? If you flip the curriculum, right? So that's what we did. We flipped the curriculum, and this arguably is perhaps one of the most innovative med schools in the country. But that's where, again, when you think about health, learning, and community, right? This is a part of the community. It's part of the Brooklyn district. But this is also where we bring in investors and innovators and entrepreneurs and researchers and scientists and into the community. And we're creating, by the time we're done with the Pearl, Justin would have created 11,500 new jobs. Right? Women, minority-owned businesses, not just large tech companies like Siemens and Stryker, Medtronic, Johnson & Johnson, Boston Scientific, or startups like Proximity Health and a number of others, but also women, minority-owned businesses and others. So really this ecosystem of intentional collisions between players really focused on, again, intentionality and purpose.
Love it. Congratulations. I know it's been a lot of work. What are you most excited about happening in the industry, what you're seeing in the industry today?
Yeah, I'm excited with the fact that AI has come of age, right? So we talk about AI quite a bit, and oftentimes it's really this bubble, and you're just like, talking about AI for the sake of talking about AI. We're investing in AI because someone's thrown a .ai out at you, right? But as a radiologist and as a health system executive, I get to see the fact that look, this is actually making a difference, right? It's saving radiologists and physicians time.
Absolutely.
Right? It's allowing for them to focus on the things that they need to be focusing in on, right? So when you talk about conversational AI and ambient listening, and these are things that have now really taken off and should in fact be the standard of care and will quickly very much be the standard of care. And in radiology, if you look at all of the FDA approved applications out there, it's 75% or so are in radiology.
Yes.
And I think it's quickly getting to a point, Justin, where if you're not using AI, chances are there's going to be something quite dangerous that might happen that you may not catch.
Exactly.
Right? When it comes to the litigations and I think it could get to a point where you might get sued if you're not using AI.
Yeah.
Right? I mean, it's really getting to that point of really transformative impact that is really changing the way that we're practicing care and also changing the way that we're looking at the business of healthcare.
Absolutely. You're the second. So John Holomka, our good friend John, has been saying that now for about a year. If you're not using some type of AI, you could actually be basically you need to worry about malpractice at some point in the next 3 to 5 years.
Exactly
for sure.
right. Yep.
So agree. So what are some of the trends that you're seeing out there in healthcare today? Obviously, you're on the front side. And obviously, you talk about AI and how we're seeing that now going into use much more than we're talking about it.
So, I love that there's an abject level of focus right now on rural health. I think that's really important, right? And especially when you look at a health system like Advocate Health, and we've grown tremendously in the last many years. Growth, a lot of times, conflicts with innovations in rural health, right? But not for Advocate. And we're really double downing on, the remotest parts of Georgia, Macon, Georgia, right? Or
Jeff
Rome,
was on my
Georgia.
show last week.
Well, that's exactly right.
Yeah.
Or in Milwaukee, right? Outside of Milwaukee, in Wisconsin, or remote parts of Illinois and the Carolinas and such. And so we're really pushing the boundaries of innovations in rural transformation and rural health. I think there are tremendous opportunities around that. I'm also really excited by the fact that care is shifting now dramatically away from the bricks and mortar facilities.
Yes,
right? So health at home and wellness is now a thing. It's not just a nice to have or something that certain consumers are demanding. It is a business model that many are now gravitating towards, and we've been leading that charge with our Connected Care Everywhere strategy now for a while, and the largest hospital home program in the country. And I'm really excited about the fact that care shouldn't and doesn't always need to be focused in only on the bricks and mortar. The clicks and mortar element of care is becoming quite real as well. So I'm excited about that too.
So if you're obviously you're Advocate. So if you're another health system, not quite the size and scope and scale of Advocate, how do they begin some of these journeys? Because everybody's on a different level of adoption and different strategies, and they're different for different communities. But where would someone start? Like as a CIO or a CMIO, or where do you guys begin that? Where do you begin that journey? Obviously not from day one, but how do you give them the plan, the roadmap for the confidence to go forward?
Yeah, it's easy when someone says do what matters, but really at the end of the day, you got to do what matters, right? I think it's really important not to get blinded by this shiny object syndrome.
Absolutely.
Right. I mean, there's so many shiny objects hitting us left, right, and center. So just do what matters. Be focused in your business model, right? So it could be a smaller health system, a smaller community center, or whatnot. But be focused in on what matters to you and what you're about and what you stand for, right? At the end of the day, it's also about partnerships. Right, and whether it's for larger health systems like us or smaller health systems and clinics and others, I think you got to partner. I mean, healthcare is too darn hard and too darn complex for any one of us to try to solve for it on our own, right? So I think we got to partner intentionally, right? And it's not just partnership for the sake of partnership. I'm always a big advocate of skin in the game.
Absolutely.
How do you co-create and co-develop and really partner the right way so that you can really move both of the agendas forward.
Yes.
And I think that's really important as well.
You're great at that at UPMC, and obviously great at that at Advocate too.
Thank you.
So looking into the proverbial crystal ball, what do you think, and again, I know this is probably fastest to AI, but what do you think is something that we need to be ready to navigate in 2 to 3 years from now? I know it's tough and things are evolving quickly in some areas, not quickly in other areas. But what do you think we need to be ready for that we're not talking about today?
Well, I'll give you a response that maybe you haven't heard too much of.
Love it.
Right? I think it's going to dawn upon us that what we really need is business model innovation. Right? So not just, again, let's throw more AI at it, or or even some of what I talked about in remote patient monitoring and wearables and so these are all important. But I think what's even more important is business model innovation. If we're not really thinking astutely about the business model, right? And if we're getting incentivized in the ways that we've always practiced care for years at a time, it's going to be an impossible uphill battle, regardless of how many
Absolutely.
LLMs you throw at it, and
You're right.
regardless of how many shiny objects you put in front of health systems, right? So business model innovation, I think, is going to be really important. What that means is we need to think differently in terms of the value that
Right.
we're generating and accruing, the shared risk that we're taking, right? So there could be tighter deals with payers, there could be more value-based contracts, there could be different ways that we're incentivizing certain elements of the care model transformation that's playing out. I think that's really important. And Justin, I would even argue that until and unless we get to that point, I think we're just chasing all these shiny objects and running around in circles.
Yeah. I agree, and I think, I mean, you gave us some really good examples and foundations on how people can start to look at that in their communities, because I think we've also got, I mean, you and I talk about this almost every year, so there's personal responsibility in here as well as us as citizens, whatever country you're in, but as us as citizens of the country, and how we take care of ourselves, and what do we bring to this equation, because we can start thinking like that as a society as well, because government's one piece, our company where we may work is another piece, but us as citizens, we also need to start looking at ourselves, because this is getting a little bit, we're not getting exactly healthier the way that we want to. You and I know we take care of ourselves for very good reasons. But that's a piece of the pie that I want to start talking a bit more of. I think that goes back to what you just said of when you're creating community, if you get people more involved, you educate them more. People don't even know. I'm shocked how many people don't understand about healthy eating and aspects like that, and sort of bring that to your point is when you bring that discussion out to them and you start to do these partnerships, you open up their eyes and they're going to say, you create a better community in that regard. So God bless you for that. I love that piece because we don't talk about that enough. So in our closing minute or so, where are you off to the rest of the year? Are you going to do fall forum, Chime Fall Forum, reInvent?
Yes, I will be at the Chime Fall Forum. I'm actually speaking there, so it'll be fun.
Awesome.
Yeah. So look, at the end of the day, it is about continuing to create more impact, and I'm excited that we're up and running with the Pearl and the new medical school in IRCAD North America, and we're already starting to think about what's next. How do we build on this and really take this to the next level? And then similarly, we're really focused in also on innovations in other parts of advocate health, south side of Chicago. That's a big area of focus for us, right? This is
where you guys started, wasn't it? I mean, Advocate was there 10, 15 years ago.
Well, yes, and now with Advocate Health, we've committed to really address some of the disparities that exist between the south side and north side of Chicago. There's a 30-year life expectancy gap between the two areas there, and so we've announced $1 billion investment in the south side of Chicago, and there's some amazing things that we're doing. And it's not just about building a tower, right? That's not how you solve for some of those really deep and ingrained challenges. It's about bringing in the right partnerships with barbershops and with community practices, with churches and pastors, but also bringing in things like point-of-care ultrasound devices and looking at care model transformation in very different ways, right? And changing behaviors and patterns and habits and using data and AI capabilities around that to really influence, true transformation, especially in a deeply rooted set of challenges such as that. So super excited about that, right? Because again, innovation isn't just about setting up a new medical school and a big robotic institute. Those are really important, right? But it's also about rural health. It's also about things like the south side of Chicago and addressing some of the biggest challenges that exist in healthcare.
I love it. Rasu, thank you so much, my friend.
Absolutely.
Great time. Appreciate you, man. Thank you.
Awesome.